little late today. We'd like to start at noon. We ran a little behind, but we're here and we're planning on doing the Radiesse demo as we had previously talked about. This is for hand rejuvenation. I've done Radiesse previously on another video for cheek rejuvenation and volume in the face. But where Radiesse is really, it's been FDA approved also for the hands, and that's why I want to share that with you today. It's a really good procedure, very easily done in the office. 20-30 minutes, you're done, and your hands actually do show your age. I mean, people take care of their face, they take care of their neck, and then the thing that they forget about is their hands show with their clothes on, and they've got anything to cover the chest, but their hands show their age. And so this is an easy procedure. The injection lasts about a year. As you continue to do the injection, it lasts longer and longer. So this is a procedure that I really like, and I'm going to share that with you today, how easy it is to do. Our model here has graciously accepted and said she's happy to do this procedure, so thank you for being here. And so the procedure with the Radiesse, the filler is a little bit thicker. I want to show it to you. It's a white material. We've already done the mixture for that. Sorry, this phone in the background is going. It will turn off here soon. But the white material, it's a thicker material. It's made of calcium and hydroxyapatite. So that's normally found in bone. So it's a natural occurring material. It sounds funny, though, that we're putting bone into the hands, but it volumizes very well. And the body will break down that calcium and hydroxyapatite where it will be completely degraded, but in response to that, your body creates collagen and volume. So that's what you want, especially in the hands here, so that it will last a longer period of time. Okay? So before we get started, we already put on numbing cream. I usually put that on for a good period of time. I think for her we put it longer, so it's pretty numb now. We already just took off the numbing cream, and I'm going to wash one more time with chlorhexidine wash. This is something I used before surgery, and we're doing it more and more now for fillers that last a long time to really reduce the risk of infection and granulomas. That's something can happen with any type of filler, even hyaluronic acid fillers. So that's what I'm going to do right here before we start. So a little bit of this, it's not coming out completely right now. Well, it's not coming out like we need it to, so I'm just going to do a little opposite of what I normally do, but okay. Let me just wash this real quick. This is a little soap. Feels a little cold, sorry. Sorry for that. Do you, I'm just going to roll up your sleeves a little bit. Yeah, that way we can get
Pull them up, okay.
Yeah, we can get a good view of the hands. So I want to show you guys her hands here, because that will demonstrate to you why we're doing this. The skin, as we get older, is very thin. It starts to thin out. And besides that, we also get, and this is just saline now, we get our tendons showing, our veins showing, and a volume loss happens between the tendons of the fingers here. Okay? So that's what you're seeing, is this volume loss. Why don't we do a little comparison, my hand and her hand? Okay? Side by side. Just so you can see the difference in the aging that's happened with the hands. And that's what people forget. Okay? All right. So before we get started, I have to get some gloves. Could you grab me some gloves there? Let me just grab them real quick. No, that's okay. Go ahead. So the material is here, Radiesse. Here's the box. And we already just pre-mixed some lidocaine into the material itself. So I like to do it with a cannula. If you take a look on the end of this, It is a very blunt opening. There's no sharpness to the end of that needle. I'm going to put with a background a little bit higher here so you could see that, but it's not sharp. It's actually a blunt tip. I use a needle itself just to make the hole, okay? And I'm going to just go in between each of these areas where you see the volume loss happening here. See what I've done with the skin here? You can see that where it glides over everything really easily as the skin has thinned, okay? So a little poke. Sometimes it may bleed. I'm avoiding her big veins. And then right here. Okay. So each of these spots. Now I'm going to pick up the skin and I'm just going to go in each spot here. Okay. How are you feeling?
Me?
Yeah.
Yeah, good.
Okay. Just a little bit there. You can see the filler going in. Okay. I'm going to inject in each little spot here. Any pain?
No.
Pressure? A little bit when it goes in.
Yeah, I felt that.
Mm-hmm. Sorry, somebody's stomach is going too. That might be me. Okay, good. I use a cannula so I can prevent any injury to blood vessels or nerves. The skin's really thin here, so there's not much room in between, but it's very hard to injure anything. And do one more right here. You can see it's tenting up the skin, so there's really no way I'm going to injure much there. Okay, so I've done that. I have you just roll your hand forward so I could start to massage the material. The skin's so thin that it just moves forward, and we just get that material in. And sometimes I'll use some saline to help glide it forward, but you could see that we filled in some of the volume there already. Okay, comparison of the two hands. We'll just tint that and tint that, so you can already see a little white here, but here's the volume that's filled in, and you can see the veins more prominently here, just at the surface back here. I'll be filling in some more, and you'll see that go away. Okay, so here, comparison to here. All right. Okay. Do a little more injection. How'd that go?
Good.
Yeah?
Yeah.
You can see it right before your eyes,
I
huh?
know.
Isn't that cool?
Immediate gratification.
All right. A little quick poke here. Another poke. Very small poke. Okay. All right. And I just got to get the rest of the Radiesse that we mixed. So I mixed earlier with the lidocaine, so we're done with that there. So we usually use about 1 syringe per hand. Some people need more, some people can get away with less. But now you can release that again, come back out, yep. But that is the typical, is 1 syringe per hand, depending also on your age and the amount of loss that we're seeing. Okay. Again, here we've tinted the skin up. And please, if you have any questions about this procedure, very easy procedure, but some people always have questions and concerns. Please leave some comments on our video at our YouTube. We also have we're going live this time with Facebook. So if you also have comments on Facebook, this is my personal Facebook. We will share it to our Facebook page as well so that you guys can see that on Facebook. This will be shared on YouTube as well as Instagram. I have not decided to do Snapchat just yet. I think it's a lot of people have asked about that. Sorry, I'm not a very maybe hip young teenager doing Snapchat just yet. Okay. All right. Let's have you then make that fist again. Okay. Okay. So now I'm just sort of spreading all the material. We're gonna just get all that into the areas. Isn't that cool? I really love this material. And there you have it. So this hand compared to this hand, okay? I'm going to do a little bit of touch-up just in between here, but we're pretty much done with this hand, and you can see that. Now in the beginning it will feel a little lumpy, and then it smooths out with time. You want to ice for 24 hours after a procedure like this to the hands, off and on. You don't have to do it like when you go to bed, of course. And you want to lift and elevate your hand above your heart at night. So that's something that I would recommend you do after a procedure like this. Just the first day is to leave it elevated above your heart so you don't get so much swelling.
Okay.
Okay? All right, so we'll finish this up. But thank you again for tuning in. And after this procedure, after this video, I'm going to finish up her hands, and we'll share with you a before and after picture so you can see how that looks. Again, if you have any questions or comments, leave them. Feel free to leave a comment there on our video, and we'd love to answer your questions. All right. This procedure, if you are interested, please call our office at 805-715-4996 or visit our website at www.facesbydrt.com, and you can contact us for an appointment, an easy appointment there. Okay? Thank you.